Have you heard of Chat GPT? It's an artificial intelligence language model. GPT stands for Generative Pre-trained Transformer. You type it a question and within a few seconds a response appears. You can ask it anything. It will write poems, computer code and essays. I asked it to write me a limerick about hip surgery and here's the result. In the operating room so bright, hip replacement surgery, what a sight! With precision and skill, surgeons work with goodwill to bring back the patient's delight. It wouldn't win any prizes, but actually it's not that bad. As I mentioned in a recent video, there's a lot of interest in artificial intelligence, particularly in healthcare. A recent study from San Diego compared the answers to some medical questions put to ChatGPT and doctors. The panel that rated the answers felt that ChatGPT ones were better than doctors in terms of quality and, interestingly, empathy. It sounds incredible. So I thought I'd ask ChatGPT some questions about hip surgery. The first question I asked was, what's the best type of hip replacement for me? Here's what it said.
As an AI language model, I don't have access to your medical history or personal information, so I cannot provide specific medical advice. Determining the best hip replacement option for you requires a comprehensive evaluation by a qualified healthcare professional, such as an orthopedic surgeon. They will consider several factors, including your age, overall health, the severity of your hip condition, any pre-existing medical conditions, and other individual factors. That being said, there are different types of hip replacement implants available, including cemented, uncemented, and hybrid options. The choice of implant depends on various factors, such as your bone quality and the surgeon's expertise. It is crucial to consult with an orthopedic specialist who can evaluate your condition and provide personalized recommendations based on your specific needs. They will consider your medical history, conduct a physical examination, and possibly order imaging tests to determine the most suitable hip replacement option for you. Remember, this information is not a substitute for professional medical advice, and it's always best to consult with a healthcare professional for an accurate assessment of your situation.
I think that's a pretty good answer. If I were asked the same question, I'd say much the same sort of things. Here's another one. Is the anterior approach best for hip replacement surgery? The anterior approach is commonly used in the US, but not very much here in the UK. Some people think that it has advantages over the more well-established posterior approach to the hip. That's the one that I use. Here's the answer.
The anterior approach is one of several surgical techniques used for hip replacement surgery. It involves accessing the hip joint from the front of the body, rather than the side or back. While the anterior approach has gained popularity in recent years, it's important to note that the best approach for hip replacement surgery depends on various factors, including the surgeon's experience and the patient's specific circumstances. The anterior approach offers potential benefits such as potentially faster recovery, reduced muscle damage, and potentially less post-operative pain. It may allow for quicker rehabilitation and a faster return to normal activities for some patients. However, it also has certain limitations and risks. The procedure can be technically demanding, requiring specialized equipment and experienced surgeons trained in this approach. Complications associated with the anterior approach may include nerve damage, fracture, and muscle weakness. It's crucial to consult with an experienced orthopedic surgeon who can assess your individual case, taking into account factors such as your anatomy, bone quality, and any pre-existing conditions. They will recommend the most suitable surgical approach based on your specific needs and circumstances. Remember, the decision regarding the surgical approach should be made after a thorough discussion between you and your surgeon, considering the potential benefits, risks, and expected outcomes in your particular case.
Again, that's a pretty good answer. It's clear, it's well balanced, and the recommendation to speak to a surgeon is exactly the right thing to do. So will ChatGPT make me redundant? Well, not yet, I don't think. As I discussed in my recent video, artificial intelligence helps us to do better, but it hasn't reached the point where it can take over what is, after all, a complex, hands-on human task. Trust and the personal touch are the foundations of the doctor-patient relationship. What Chat GPT can do right now is to help you to know more about your condition and what the options for treatment are. This puts you in control, because the more you know about what's happening to you, the more likely it is that you'll get the best treatment. Knowledge is power. Well, I hope you enjoyed watching that and found it interesting. If you've got any questions at all about hip surgery, then please get in touch. The details are below. If you've got any comments, then leave them below. I answer everybody's comments. Thanks again for watching, and I'll see you next time.